On behalf of the employer commissioners bargaining health benefits for Vermont public school employees, I'm going to do a comparison of premium and out-of-pocket, how it would look in the past under the VHP, what it looks like currently in 2021, what was proposed by the employer commissioners at fact-finding in August of 2021, and what it would be like if the person was employed for the state of Vermont. A reminder that OOP stands for out-of-pocket costs. It is the copays, coinsurance, and or deductibles that are the responsibility of the employee after an HRA is taken into account. So let's look at a real life example. Here's an employee that has diabetes and has a child with asthma. In 2017, that employee would have been enrolled in the two-person VHP plan. The VHP is the plan that over 90% of all school employees were enrolled in before the new plans came into effect. Currently, the vast majority of school employees are enrolled in the Gold CDHP. So we're going to look at what it would be like for this same employee to be enrolled in the Gold CDHP parent-child plan. We're also going to look at what if they were an employee of the state of Vermont enrolled in the two-person select care plan, which is the plan most Vermont state employees are actually enrolled in. So we have to make some assumptions, and the assumptions are consistent across all of the different scenarios. During the calendar year, the employee has 3 office visits with a PCP and manages the diabetes with a generic prescription. During the calendar year, the child has 4 office visits with their PCP and 2 specialist visits. The asthma is managed with a combination of 2 preferred brand RX and 1 non-preferred brand RX. The following slides will show the total cost to the employee of the premium and the out-of-pocket under 5 different scenarios. The first scenario is if we could go back in time and have that employee be in the VHP in 2017 with the premium rates in effect then. This employee is assumed to have a 14% premium share because that was the average employee premium share at that time. 14% of the VHP for an entire calendar year would have been $2,484. Their medical out-of-pocket costs would have consisted of copays, $15 copays for the PCP and $25 copays for the specialist office visits. There was no employer HRA. The employer did not help at all with out-of-pocket costs. In fact, the employee had this first dollar obligation. There was no annual cap on medical costs, but in this case, the copays would have added up to $155. When it came to pharmacy, again, there was no employer HRA. The employee would pay for the prescriptions when they picked them up at the pharmacy using copays, and there was a cap of $600 per person during the year. In this situation, the employee's diabetic medication would have been covered at 100%. VEHI has been covering diabetic medication at 100% for the past 2 decades. The child's asthma medications would have been paid by copays, $20 copays for the preferred brand drugs and $40 copays for the non-preferred brand. That would have totaled more than $600, but been capped at $600. So the entire amount of money, premium and out of pocket, would have been $3,239. Now, let's imagine that the VHP was still operating today. It wouldn't still have the 2017 premium rates. So I trended those premium rates 5.5% per year to get to 2022. You might remember VEHI rates have averaged 11% the last 4 years, but I used 5.5% because a substantial amount of those double-digit increases have actually been driven by the HRA values, and that will be discussed on a separate recording. So everything is the same 14% premium share, but now we have a higher premium. And so it's now $3,247 for that premium. Same out-of-pocket cost. I did not change the VHP at all other than the premium amount. So the person would be spending $4,002 in 2022 as opposed to what they would have spent in 2017 in the VHP. Now let's look at the current situation based on the arbitrator's decision. This situation has a non-licensed employee, and so they have an HRA from the employer for $4,400. Their premium share is now estimated to be 16% because that is the average premium share for non-licensed employees. It is scheduled to go up 2% next year, but we are still looking at 2021. 16% of that lower premium of the gold CDHP would be $2,364 a year. The medical out-of-pocket would be $0 because the entire out-of-pocket for those office visits would have been covered by the $4,400 HRA. And there would be no cost for prescription medication because asthma and diabetic medication is covered 100% by VEHI. This means that the total this year for this person is $2,364. What if they were a state of Vermont employee? Well, state of Vermont employees pay 20% premium, and they have a higher premium because their plan is more similar to the VHP than the gold CDHP when it comes to premium share. It's a 95% actuarial value. And there's another recording that speaks to actuarial values if you'd like to learn more. So the premium share would be $4,170 based on the current rates. The medical out-of-pocket for state employees, they do have a $1,500 annual cap per person. They don't have any employer HRA. They would also be paying copays. However, the copays are higher than the VHP. So they would be paying $235 in copays for the office visits. For pharmacy, no employer HRA, an $800 cap per person only on generic and preferred brand. They must start with a $50 deductible each year, and then they would be paying 10% of the generic cost. Notice that's not a copay, it's 10% of generic cost, 20% of a preferred brand, 40% of a non-preferred brand. So in this scenario, they would be paying $563 towards pharmacy for just under $5,000 in the year for both premium and out-of-pocket combined. What are the employer commissioners proposing? We're proposing a $2,500 employer HRA. This would be a reduction from what they currently have, but still be substantially generous and protecting the employee from out-of-pocket costs. The employee would be paying 20% premium share under the employer's proposal. So that is $2,955. Their medical out-of-pocket costs would be $150 because the HRA would pay the first $2,500 and the employee would be responsible for what remains. Again, asthma and diabetic medications are covered 100% by VEHI. So the person in this situation would be paying $3,105. So that was a lot of numbers and a lot to hold in. So let's look at a side-by-side comparison. The VHP in 2017, the employee would be paying total premium and out-of-pocket $3,239. Note that these are pre-tax dollars, so it would not cost the employee that much in foregone salary because there's a 30% tax savings that is applied to any take-home pay. and not applied to the FSA or to the premium share. If we imagine the VHP in 2022 with a 5.5% premium increase year over year, if we were not in new VEHI plans, they would be paying over $4,000 a year. Currently, because they are having the advantage of paying on the lower premium gold CDHP, so the percentage would be higher at 16%, but on a lower premium plan, no out-of-pocket under the current arrangement because the HRA is so generous, they would be paying $2,364. State of Vermont employee would be paying quite a bit more in premium because they're paying 20% of a higher premium plan. They'd be having higher out-of-pocket cost for a total spend of $4,968. And the employers are proposing a 20% premium share of the lower gold CDHP plan. So $2,955 in premium, $150 in this scenario for out-of-pocket because the HRA at $2,500 still covers first dollar, a substantial amount of out-of-pocket exposure for $3,105. One final slide, taking a look and comparing them with actuarial values and some comments included. To learn more about actuarial values, please look at a separate recording on that topic. The VHP and the state of Vermont plans both have actuarial values of 95%. Neither one had any employer help with out-of-pocket costs. The employee was responsible first dollar for every copay, every coinsurance, and every deductible that came into play. There was limited preventive coverage under the VHP, 100% preventive coverage with the state of Vermont. There was no cap on medical copays in the VHP. There is a cap in the state of Vermont, and there was a cap on prescription drugs in both the VHP and with the state of Vermont. Currently, because of the HRA, the 84% gold CDHP actuarial value plan becomes a 98% actuarial value plan, just under 98% for licensed employees, just over 98% for unlicensed employees. That's because the employer has a first dollar, very generous HRA. In addition, the employees have preventive and wellness medications covered at 100%. With this employer HRA, the employee has no out-of-pocket costs until they have $3,800 in claims. Then the employee pays just 20% of future claims until they have their maximum spend of $300 or $400 as a single employee. You can find out more about how this plan works in a separate recording. Please note that the HRA value is currently greater than the RX maximum, and RX is the most price sensitive. So there is no incentive for people to have generic medications or preferred brand medications because the HRA is able to cover 100% of pharmacy costs currently. The employers have proposed a plan that has an actuarial value of 93%. That's still a Platinum Plus and richer than any of the plans on Vermont Health Connect. It retains the employer first dollar HRA. The employees still have 100% preventive and wellness medications. Now the employee has no out-of-pocket costs until they spend more than $1,250 in claims. The employee then pays $550 of the deductible and has 20% coinsurance until they spend their maximum potential of $1,250. Note that the HRA at $1,250 is $150 lower than the pharmacy maximum of $1,400. This allows people to be more sensitive to the use of generic and preferred brand drugs.